Welcome to SF Nonprofit Spotlight, brought to you by SF Commons. I'm Kelly Daly. When you look at race, ethnicity, and pregnancy in America, the health outcomes couldn't be more disturbing or different. Americans die in childbirth at some of the highest rates of any developed nation. And when you look in particular at Black women, they die during childbirth at a rate 3 times higher than white women. But there's a San Francisco organization that's working to improve maternal health and infant mortality rates. For 2 years, SisterWeb has connected pregnant Blacks, Latinx, and Pacific Islanders with culturally compatible companions called doulas. They help empower parents to be with giving them resources and support that they need for a healthy, dignified birth journey. And joining me today is someone who is leading the programs at SisterWeb, the director of programs, Marley I. Mystic. Hi, Marley I.
Hello, thank you for having me. I'm very excited to be here and to speak about one of my passions, which is doula support and caring for families here in San Francisco.
That sounds terrific. And just so that everyone is on the same page about what a doula is, can you maybe tell us about some of the origins, backgrounds, and how you came to learn about doulas?
Most definitely. So doulas currently provide education, information, physical and emotional support to birthing families and parents to be, but it is a tradition that is as old as birthing itself. There's always been people there who were to support the families, preparing them for the birth, helping them get ready for the labor, and to be there in person to support. And historically, this was a woman. This was someone who worked closely with the midwives or those who had the knowledge to bring forth life. And they usually were noticed in their youth that they had a spark or some type of inclination towards this work. And it was taught in a community way, in an apprentice type way. And as we have progressed and become super cultured and went medical, doula work became more official. Many people would say that they were doulas and supported work, but didn't know about the actual word or the profession. It is a Greek word and it sounds a little strange to some, but it's work that is very ancient. And I believe that it's being elevated now because of those disparities that you've listed previously and the fact that continuous support has been shown in research to change those outcomes.
You know, Marley, you mentioned someone showing a spark for birth work, even as a child. Maybe can you talk about your experience with being a doula and being attracted to this work?
Most definitely. It was always a spark in me. I grew up in a community and had several older brothers and sisters. And right around the age of 12, my siblings began to reproduce and bring forth these lovely little lives that I was so excited to be a part of. And watching that journey of my sisters and sister-in-laws as they developed from, seemed like from nothing, from thin air to bringing forth this life was amazing to me. And I had the opportunity to attend a couple of births at that young age of 12. And it really set me on a path of saying, wow, this is amazing. I want to be in tune and in communion with this energy of life that comes around when babies are born. And for a long time, I thought that meant that I wanted to be a pediatrician or some type of doctor. But really, it was that I wanted to be there to support the families during the birth and not provide that medical care, but provide that support to help normalize the whole process and to help really instill a sense of trust of their own bodies and of their providers as they went through this journey. So it took a while for me to even realize that I wanted to be a doula. I went to school and thought I was going to work in nonprofits and do all of this, and really decided after I had my second child in a home birth with the assistance of a doula, that this was work that I could really get into. And my doula for that birth actually connected me with the training and was like, hey, you are already a doula. You've been supporting people since you were a child. You should go ahead and get trained and do this work. And I was fortunate to be trained with midwives. So it takes me back to that old tradition of being able to work with the ones who are doing all the medical support for the patients and for the clients, and to get that understanding of how we work as a team to support that birthing family and that person. And I got certified in 2012 and have had the opportunity to help family, friends, and folks who just found me on the internet. And when I came into SisterWeb, it was the first time that this profession was legitimized for me, that it wasn't me being an entrepreneur or me trying to have a side job or a gig to, bring in some extra money, but the fact that I could be employed to do this work, that it was actually, a legitimate and a fundamental career path. And SisterWeb has opened that up for myself and so many more doulas.
And speaking of finances, hiring a doula can be really costly for some people, but SisterWeb provides services for free. And I'm wondering if you can tell me a bit about what you're hearing from clients about how they benefit from this service.
Most definitely. I think that is one big point, is that when you hear about doulas, you often think that it is for the privileged, that this is something that only, a certain demographic can afford, and it's going to look a certain way. And that's one of the reasons why SisterWeb is so remarkable in the way that we provide care, because we provide it for free to those who are really in the most need. The reason that we serve the Latinx and Pacific Islander and Black communities here in San Francisco is because those are the three ethnic groups that have the biggest disparities in our city. And so to be able to provide that for them has changed the birth experience. We are able to not only be there to support them in birth and prepare, but also help them engage with their providers. And with the history of this country and the medical field, we often see fear, ambivalence, a lack of self-confidence when people are going to receive support. And with their doulas there, they feel more confident. They're able to advocate for themselves and to also ask the questions that they may not have wanted to bring up. So we've heard clients say that they felt more respected in their births, that they don't know how they could have done it without their doula, that at first they weren't sure that they needed somebody else in the room to be there with them because they've had children before, they've had family members who've had experience. So what is a doula going to do for me? But after having that, they understood that the perspective and the experience that doulas have really open up a world for them where they have more control and say over their body and over their experience of birth. So it's really just, I like to compare it to like a life coach, in the sense that you have someone there who's going to help you ask the right questions, who's going to help you get to the goal that you set, not one that is set for you. And oftentimes when families are going through the pregnancy journey, they get things set upon them or foisted upon them. And your doula is really there to help you have the experience. We're non-judgmental. We don't have an agenda. We are here to help you have the experience that is going to make you feel the most respected and empowered in your birth.
You know, Marley, I'm talking to you on a day where San Francisco is loosening restrictions, right? The COVID restrictions where we couldn't go inside. There were so many requirements. I know that in-person services versus virtual probably was a big discussion for SisterWeb. Can you maybe tell us how the pandemic has impacted the organization?
Yes, we are coming up right on a year of everything shutting down and the change coming in the way that we practice. And SisterWeb's model of care is very hands-on, very personable, because we notice that with medical care during pregnancy, you often see different providers. There's no continuity of care. And even when you do see the same provider, when you go in for a birth, it may not be the provider who you're comfortable with. And we know that opening the cervix is a sphincter. You have to be able to relax to a certain extent in order to open. And so we were very consistent on providing in-person support throughout the whole journey. Clients can get matched as early as 10 weeks and begin to build their relationship with their doulas. And what this looked like for us is coming to their home, doing 2-hour visits, getting to know them as a person, their fears, their desires, their past experiences, and really building a trusting relationship with them. So when COVID started coming to the Bay Area and the hospital said one support person only, many of our clients had to decide if they were going to bring their partners or their family members or loved ones, or if they were going to bring their doulas. And us as an organization had to decide what is safe for our doulas. How do we safely bring them there to support? Because no doula wanted to leave their client alone in the hospital without their support. We had prepared for it. And I think the roughest time was March last year, when we had clients who had been with us for a significant amount of time, and we immediately had to shift to say, hey, we're only going to be able to support you with text messages or phone calls or video chats. And a lot of the hospitals don't even have good reception on all their floors. So it was a real challenge for us. But thankfully, SisterWeb has an initiative called the Champion Dyad Initiative, where we have close partnerships with 5 out of the 6 birthing locations here in San Francisco. And we're able to do bi-directional feedback. So those relationships that had already been built allowed us to have those tough conversations with the hospitals to advocate for us, but to also advocate for the well-being of the doulas. Because it's one thing to say, okay, let the doulas in, but it's another thing to say, let them in and let them switch out. Let them be able to, leave if someone is COVID positive. So we had to switch things, and we found that our model of care required significant shifts in the amount of contact that we had, where we were able to do 3 prenatals previously and sit down and come to your home and, break bread and share. Now we might need to check on you weekly with a phone call or a text message. And so our emphasis was on how do we create those bonds in a virtual world and prepare them enough to feel like they can advocate for themselves in the hospital. And what that looked like for a lot was miniature doula trainings for that support person, incorporating their team to say, hey, get on a video chat and let's go over those different positions for birth. Let's go over how you advocate for yourself, going over the benefits, the risks, the alternatives, and how you can talk and speak about that. And then we also had some support from the birthing locations to say, we have tablets here. You let us know when your client is coming in, and we can roll a tablet in there and you can be on that video screen supporting your client just as you were in person. So it was a definite shift, and it took some time for us to get there, but we did notice that we had more contact, more relationships, and we noticed a greater need. A lot of our clients needed more than just the birth support. With COVID hitting, there were financial impacts, there were access to food. And so a lot of our resources went to finding and outsourcing places where we could make sure they had supplies, personal protective equipment, food and produce deliveries. And so our care really became more. And I think that's one of the beauty of this whole pandemic, is that it's a shock and things shifted, but there were so many opportunities to do things that change for the better and to provide more holistic care for our clients.
And another period, another item that is really relevant to this period is that baby boom, right? Like, is it real? Has it really hit San Francisco?
It definitely has. People are spending more time with each other and having their bubbles. And so we've had a lot, upsurge, definitely come November. There were a lot more referrals. And unfortunately, we have a cap at our capacity. Our program can only provide support for as many doulas as we have. And so we've had more people on the wait list. We also saw an uptick in people wanting to do home births or out of hospital births, and being able to provide resources for them to say, here's a list of midwives you can contact and find that support. So we've seen a shift in not only the quantity, but also in the quality of care that people were getting. Because we have to remember, they also limited the prenatals, where only that birthing person could go in. You no longer could come with your partner or your friend or your loved one. They had to be on FaceTime. So it was a more lonely time for our pregnant moms. We noticed that a lot, that they were like, I have to do all this alone, or I may not even go into a office for a meeting. I'm doing a virtual meeting with my doctor, and them feeling like nobody is looking at me. My doula's not here, my doctor's not here. Where do I get that support? And so we've been able to just expand our care and our acknowledgement of how different things are, and to shift and personalize our care for each client.
In a time where healthcare access and equity are such concerns for so many people, Marley, I really appreciate hearing what you're doing to help pregnant people have a great, healthy birth. And I love the idea of supporting people with care and food and resources, even afterwards. That's so many people have stepped up, and to hear that SisterWeb is doing its part too, I really appreciate hearing details. Thank you for your time. Thanks for joining us today.
Thank you so much.